Now, a possible decision could have a disproportionate impact on women of color here in Wisconsin.
Sarah McGrew talks with a health expert about their concerns.
Chantel Riley is a registered nurse and works with the African American Breastfeeding Network. She also had an abortion in her early 20s.
To make that choice myself, but based upon my individual circumstances, my individual situation, and knowing what I felt was best for me.
That choice included her financial situation and her mental and emotional preparedness. She says as a healthcare professional, the impact of not having that choice disproportionately affects women of color.
We already have this disparity as is. You're increasing the risk for us.
The University of California, San Francisco's Medical Center studied these barriers to access. Dr. Ushma Ukabiai says if the Supreme Court draft becomes final, we would likely see more people seeking out unsafe methods of abortion.
We have evidence of that in the face of greater barriers. People are more likely to resort to harmful means to end their pregnancies.
A study from Duke University shows there would be an overall 21% increase in pregnancy-related deaths, but a 33% increase for Black birthing people.
How do you see this potentially impacting or having a greater impact on women of color?
We know that about 60% of people accessing abortion care are people of color. We know that people who carry to term, who are forced to carry to term, face significant disparities in healthcare, in maternity care. We know that maternal morbidity rates are much higher among Black and Brown women. So we have a lot to be concerned about.
Riley says because of the choices she made to get an abortion, she's been better able to care for the kids she has now. She hopes the access she had remains available and safe for others.
I was able to become, a registered nurse. And that would have not been as easy. It's kind of hard to even think like what my life would have been like if I didn't have access.
Reporting in Milwaukee, Sarah McGrew, TMJ4 News.